All right, so our group is doing hospital electronic medical record systems. My name's Connor.
I'm
I'm
Lauren.
Vanessa.
I'm Jocelyn.
We'll be covering the definition of an EMR, the workflow impact, the implementation and post implementation maintenance of an EMR, vendor comparison, and the future of EMRs. EMRs are important in healthcare because they save time by providing accurate and complete information about patients and quicker access to patient records. They are efficient and accessible. EMRs reduce the need for manual record keeping, and physicians can access them at any time. EMRs reduce errors and duplication brought on by manual record keeping and duplicate tests or procedures due to physicians seeing complete patient records. They improve patient safety by reducing medical errors and providing up to date patient information. EMRs can also alert due to interactions and patient allergies. An EMR is a digital version of a patient chart. It includes the patient's medical history, like illness and medications, plus billing information and disease codes. Most include images to aid diagnosis. These these records help prevent errors and make sure physicians complete all necessary paperwork before a patient is discharged. An EMR and EHR are very similar, but the biggest difference is that the EMR system is used for a single practice or hospital, while an EHR system is interoperable with other locations. Because of this, multiple physicians cannot see the EMR patient record and they cannot contribute to it. Both capture medical information digitally, allow a single provider to input information, and it allows providers to access information.
So this helps streamline our operations. Centralized patient records lead to less medical errors and reduce time searching for charts that are paper that could easily get lost. There's seamless communications between departments and different care teams, and then there's automated scheduling and task management systems, as well as quick access to labs and imaging results that help the patient move along. So some of the benefits for clinicians are reduced paperwork, improved decision making, and fewer errors. Patients also have faster care and they just have improved safety because of all the things that are logged into their EMR. Yeah. And then overall, there's just enhanced billing accuracy, error reduction, and efficiencies. So some of the adoption, it takes some different steps. So there's project planning, so defining kind of the scope and goals of the EMR, and then the budgets and timelines. There's also staff training to help that make sure that all the users know how to actually navigate it and can use everything to their best ability. And then moving all the data over from existing records accurately. And then there's monitoring once the system is actually launched. So it'll provide support and kind of track the performance of the EMR. And then some challenges. Sometimes there is some staff resistance to change just because you're moving from paper to digital or different systems like that. There can be some errors moving data over, or there can just be a loss in general. Sometimes there are high upfront costs or resource demands, and then sometimes integrating it into a new system or into a current system can bring some challenges as well.
Okay, so post implementation support, we plan on doing ongoing maintenance and training. In order to ensure successful implementation, you must continue to work on post implementation. A way to do so is continue to work on the system. Ways to ensure success are doing routine system maintenance to ensure everything is working correct. This will ensure the fast loading times and documentation is accurate. Also, regular training with staff. This ensures they're doing everything accurate and working efficiently. Just doing the EMR training, but this is also going to be built in to the onboarding orientation. That's important as it's important for the future workers to know how to work the EMR system, just like the ones that we're training. when it was implemented. And then keeping templates updated and training updated when features are changed. With these EMRs, a lot of things change. Everything's up. Like there will always be new updates, so it's important to keep that updated. And continuous workflow optimization to reduce documentation burdens. All right. So troubleshooting updates and performance tracking. We must continue to keep the system updated and track performance to make sure it's working to its capability. Ways to ensure the success are having a help desk available 24/7 for support for staff. Some EMR systems offer that, some don't, but I think it's important to have that in your system as a system to have that support. Keep up with regular updates, like I said before. It's important. Healthcare is always changing. Updates to these EMRs are always changing and advancing. It's important to have the best updates as possible. Get feedback from staff. We want to identify these workflow issues. It's important to do so as staff is your number one priority. You want to keep them updated and just you want to make sure they're to mind. And then monitor performance such as the system speed, downtime, and chart completion rate, and to make sure everything's working. So we suggested an EMR committee. Basically, when you have an EMR committee, it's important post implementation and pre-implementation. This committee will consist of your IT team, operations team, and practice managers, and maybe an executive member, probably like the CIO, Chief Information Officer. The job of this committee is to be the super users. They will learn and master the application to help implement the rest of the staff. This group will also meet every month to evaluate new information and to talk to the rest of the staff about what's happening. They will be very helpful post implementations as they will be able to do routine training and education. All right, so the vendor comparisons. I'm first going to talk about Epic. Epic is a leader in the EMR system with 30% of acute care using their systems. Epic continues to add more hospitals and other facilities. Just as recently, MedCenter added Epic. Epic streamlines processes. It provides care-centered access and patient data seamlessly without the need for paper-based records. This reduces administrative burdens. They have a MyChart integration, which is a very unique tool for patient communication, which is a very great thing. A key feature is the storyboard. This is a feature that gives clinicians a quick view of patient info like medications and history, and it's all in one place. It has excellent reporting tools for quality measures and other audit, and it is preferred with larger hospitals. So larger hospitals like the Med Center can benefit from this. When reading online platforms, it states that Epic is great. However, it's relatively hard to learn, and the implement cost is very high. It takes a lot of time, probably up to a year to implement. Epic has a partner program that I liked a lot. It basically adds other solutions that you can add on, like AI tools, stuff like that. All right, so we also chose Cerner, which is also known as Oracle. Cerner is the second largest EMR system behind Epic. Cerner has a power chart, which provides providers with online access to patient data and has a wide range of templates. The workflows integrate easily with other Cerner molecules like pharmacy, imaging, and surgery, which make it seamless for inpatient and outpatient workflows, which is great. It also has a mobile access feature that I wanted to point out, like Power Chart Touch. Basically, a doctor can go into the charts on his iPhone, which is pretty cool. It also has strong population health and data analytic features. It has a cloud-based modernization, which is a new addition under Oracle, which just bought out Cerner, and then offers flexibility, which is good for systems that need that. All right, so I just kind of wanted to do a key difference on Epic and Cerner. One key difference is Epic has a larger market. Kerner's market's smaller, which means more people basically use Epic. Typically, Epic is a higher cost, however, which basically mean that usually larger health systems use that. Kerner is more affordable, attracting those mid-sized health centers. Uh, it is structured. Epic is structured and consistent implementation approach with strong vendor support, and Kerner supports it's widely flexible, meaning organizations heavily rely on their internal build teams, which makes Epic a little bit better in that side of things. Epic is highly customizable, and Kerner's not as customizable. It's more simple. Kerner really likes to promote itself as a simple uh, application, and then Epic is strongly interoperable with its own systems, and Turner has strong interoperability within its own and other systems, which is a pro. I would say while both EMR systems are great, we would choose Epic. They have which one is their own implementation team, which is a huge pro, and I think that's one of the reasons why we would choose Epic. But also, we would choose Epic due to its highly efficient clinical workflows that improve documentation, speed, and accuracy. Epic has long success throughout the U.S. and is trustable with providers. Most providers recommend Epic, and Epic's also known for its innovation. And we believe that innovation is needed for success in the future.
Okay, so of course, EMRs have evolved a lot over the years. So they've been from paper charts to digital documentation, and we've also added like patient portals on your phones and everything. In 1992, there were inadequacies that became more common in paper records, and so the Institute of Medicine advocated for a switch to EMRs, but this was delayed because of high costs, data entry errors, and poor acceptance from the medical professionals. EMRs obviously involve patient data, health history, family history, vital signs, progress notes, and care plan information. Um, you can access them from anywhere, like your cell phone, laptops, tablets. That's been a big change over the years. And hospitals also are using electronic devices to update EMRs. I used to work at Greenview, and we added, or like they started doing iPads that go in each room to update patient information, such as like your registration stuff. So somebody will come on the screen and ask you like all of your basic information and get your insurance and everything through that. So again, the future of EMRs, the integration from homeware devices, so Apple Watches, heart rate monitors, glucose monitors, stuff like that. It definitely would add to like EMRs, like being able to update them from your home rather than having to go to checkups. And it also helps nurses and doctors like understand like where your vitals and everything have been at over the last however long without you having to remember these things or write it down somewhere. Um, AI is, of course, becoming really popular, and it can help healthcare providers in expected patient outcomes and creating care plans. And a popular tool that's been used is Praxis EMR, which uses neural networks for physicians for charting in their own words. So, neural networks are computing systems inspired by the human brain to recognize patterns in data. So, Praxis uses technology called concept processing. Okay, we've got 10 minutes left. Um, Concept processing that captures the physician's input and classifies it into related groups, creating a knowledge base. And that's rated the number one AI used in EMRs. And then predictive analytic dashboards, those also include AI generated scores for sepsis, falls, pressure injuries, respiratory failure, and other things. And it also creates visual alerts to appear in flow sheets, provider notes, handoff reports, and your mobile EMR apps. So for class engagement, if you could pick one feature to use in an EMR system as an employee and or a patient, what would you choose and why? So I said as a future nurse, it would be difficult to choose from the one-click clinical summary for shift changes because that would make things like really easy in order to like hand off your patient and you click one button and it summarizes everything from the shift. But it's also it would be hard to choose from that and the auto integration from homeware devices because when patients don't remember the last time they checked their blood sugar, the last time they did something, or what, things like that, it would be a lot easier to already have that in the chart. And then the call to action, doing things such as strengthening the interoperability, so adopting standard protocols, improving training for employees, expanding patient access, so updating the patient portals and those apps to ensure like they're using it accurately, enhancing cybersecurity, to educate staff and like what they should look for with like cyber attacks, and then monitoring outcomes. So consistently measuring the EMRs for like what is working, what's not working, how to adjust, and like making sure smaller issues don't become a bigger issue. These are just all things that can be done to improve these EMRs and ensure like we're getting the best use out of them. And here's our references. And that's it.